Graduates Conversations podcast.
Hello everyone and welcome to another episode of Conversations podcast. Today I am with Dina Kerr, Arabic Certified Interpreter and Translator, and we're going to be talking about preparing for an assignment in specifically healthcare settings and mental health care settings. This is a part of a series of episodes that I've been thinking about doing. I want to talk to practitioners who've specialized in their certain fields like legal interpreting or social welfare interpreting. And today I am very lucky to have Dina Kerr with me, who's been specializing in this field for quite some time now. Dina, welcome. How are you?
I'm well, thank you, Fatih. How are you?
Thank you so much. So tell me, how long you've been interpreting for?
Oh my goodness, 10 years.
10 years? Pretty good, pretty good. We're going to give our ages away. Time does fly.
Time flies when you're having fun.
How did your journey to interpreting start?
It started for the fun of and the joy of learning. Actually, I was employed at Telstra as a solution architect in media engineering, and one day I thought, I think I could do something with my language. I think I've got enough to do something with it. Let's do a master's degree. I took an intake test for translation at RMIT, and I got some positive feedback. And I took studying alongside working full time. And then I found the challenge really interesting. I looked at language differently. I looked at the skill I have differently, and I didn't think then of employment options or work opportunities. I just thought of the challenge of a master's degree, to be honest.
Well, and you ended up as an interpreter, and specifically a healthcare interpreter as well. And there's a lot of demand for healthcare interpreters, especially in recent times. And so I wanted to take this opportunity to talk about how to prepare for a healthcare assignment, so that, maybe we're able to give some tips there to our listeners. But before I go into some of those tips, tell me, why does an interpreter prepare for an assignment? Why shouldn't they just receive the job offer and then go to the job and wing it? And why are you preparing?
I will tell you about the 5P rule. Proper planning prevents poor performance. Because when you plan for anything really in life, in a project, in even just taking a simple task as interpreting, as many could think that I could just wing it, it prevents poor performance. It saves you from, making a mistake, from being embarrassed, from misleading your client and the doctor or the specialist or the healthcare provider. I think there's a lot that underpins your performance as an interpreter. And a lot of that is the underground work, basically. So the preparation, yes.
That's right. I think it's key. It's probably the most important thing is preparation for an interpreter, especially in a healthcare setting. We are dealing with life and death situations, aren't we? I mean, at the end of the day, the health outcome of a patient is in our hands, and we have that linguistic power. So if we don't prepare, we are putting these people at risk who are already vulnerable.
Correct. That's great risk indeed.
Very good. So, tell me, when you are, let's say you've received that job offer from whichever agency it might be, and they all have different style of job offers. Sometimes it's an email, sometimes it's a text. What do you look out for? What kind of information do you look for to help you with your preparation for a job?
I look at the hospital, the department. I look at the location. I look at the client name. I look at things like the procedure, which department is it? Is it orthotics? Then, is it foot and ankle, or are they doing something else? Are they doing a body brace or something else? So all these are important. I look at the time, of course, because I need to pick something that fits in. Do I have something before or after travel, etc. But these days with telehealth and telephone interpreting, things are maybe a lot easier.
I mean, that's right. These days, we don't have to think much about traffic and how long it will be from one job to the other. And perhaps we can maybe now fit more jobs through telehealth and video interpreting into our day.
Yeah, we can. But then also remember as well that sometimes, I guess, working in health settings, that you're exposed to a lot of diseases and a lot of perhaps emotional journeys of clients as well, that we also, in all of that, we need to look after ourselves. So, and know it's not to burn out as well.
That's right. I mean, vicarious trauma is a serious issue for healthcare and mental health interpreters, isn't it?
Absolutely. I maybe a while ago, maybe when I started interpreting, there wasn't that acknowledgement even of agencies or organizations that provide us with work to the impact that we face as interpreters, that we need to debrief after a session, and we need to kind of offload emotionally and mentally from seeing a client. And fortunately, a few years ago, 506 now, they have introduced the employee assistant program.
That's right.
Yourself, debriefing with a counselor or seeing even a psychologist, which is, I think, very healthy and a very positive step for interpreters.
Indeed. And I think, you've brought it to my attention. We should do an episode just on vicarious trauma and how an interpreter can actually deal with that too. So let's say I've had a look at that job sheet. I know which hospital, I know which floor I'm going to, which clinic I'm going to, but it doesn't tell me what clinic is being run. I mean, I've seen job offers where it just gives me the hospital name and then it might say Clinic 2. And that's all the information that I have. And how do I prepare for something like that? What can I do? Because I look at that and it's hospital and it's Clinic B. So I'm going to prepare for health in general. So do I need to prepare for everything? How can I narrow that?
Well, we can't be doctors, remember? We can't be the specialists, and we can't be the health providers and the counselors and everything else. I guess that maybe one thing we can think about when we're preparing for these assignments is that the agency may not know much to share with you, but feel free. Every hospital has an interpreters department or a language services department, and you can pick up the phone and call that hospital and just say, can I be put through to that? I am booked for this session with this patient, and you give them the details and then kind of tell you, okay, yes, Clinic 2, that's pediatric, that's on the first floor, if you haven't got that information in the job details. And this way you can kind of know, where to prepare yourself, pediatric, what am I looking for? What is that specifics of that department? What type of an appointment is this patient? And you can say, I am doing this to prepare, to know what I'm in for. Whether you are a seasoned practicing interpreter or a startup interpreter or, a beginner in your career, it doesn't matter. It only just puts you at a better position. You are prepared, what your job is like, who you're going to see, what is the procedure, and you could read up and prepare in the background before you go to that appointment.
That's right. I think it's very important that we can tell our listeners and viewers, if you don't have a lot of information on the job offer, you can call the hospital. It's very, they're very approachable, especially if you call their language services and you say you have a job at this date for this patient at the clinic. Can I have a little bit more information about it? And then they can actually tell you what is being run in that clinic, You know, I've called hospitals beforehand, and I found out not only is it plastics or plastic surgery being run that day, but it's only plastics for burnt people, and it's only plastics for breast augmentation, let's say, for cancer patients.
Yeah.
You know, and then I was able to specify exactly what I needed to prepare, you know, as opposed to maybe just even doing plastics. You know? So I was able to concentrate on and focus on a particular area of plastics as well, which made my life very easy, and I was much more confident, and I was ready for anything that was going to be thrown at me. I mean, like you said, we can't be specialists, but we do need to know a lot about everything. And even doctors, they don't know a lot about everything. They only know what they specialize in, but we need to know a lot about everything.
And I guess maybe just to add to that, you know, investing that initial, let's say 5 or 10 minute phone call to a hospital to just kind of gauge where you could be going with your assignment, you know, saves you a lot at the end of the day, and rewards you by having that satisfaction that you have actually helped somebody. Because a lot of interpreters want to be interpreters because they want to help.
Definitely.
They want to assist that patient. They want to have an outcome achieved for somebody. And you know, if you want that interaction to be successful, then, you know, you want to do everything you can to make it that way. So yeah, it's really a small investment of, you know, that 5 minute phone call, you know, maybe 10 minutes these days if you want to hold, but it you know, it could return quite a lot for you.
So where does Dina Kerr go to for her resources when you're preparing? Are there particular websites you visit? Is there a particular publication you read?
I love these questions because I am a seeker of knowledge, I have to say. I really have something I could start with, you know, the World Health Organization Arabic English Medical Dictionary, which is in PDF format that you can get from the United Nations WHO website, to, you know, to online. Maybe the simplest ways that we can these days quickly access information is online. I am a big believer of better health channels for all information in English. I visit hospital websites that not only find details about illnesses and departments and diseases and everything else in English, but written in a very appropriate way, in a very readable way, in a way that we can understand.
That's right.
As people who speak English and want to relay information in English. But I also as well look at you know, other websites like Health Translations, which gathers or aggregates a lot of translated material in all languages, not specific to Arabic, but there's like about 1,400 resources that's been translated into Arabic. So it is a very rich language. You know, to kind of think that I don't know what procedure is really not an excuse, because the information is there. Someone has done the hard yard for you, you know, and written the process and have illustrations and a diagram for you to follow. So it's much more accessible and available than it used to be, than that kind of looking through books and dictionaries.
And, you know, interpreting, as I'm sure you would agree, it's not just about words, is it? We're not just interpreting words here. I mean, we need to really understand the system, understand the healthcare system, as well as the body systems, understand the disease, understand the treatments. And I think that'll definitely aid in our interpreting. So, you know, building this knowledge over time, and you know, it could be the fact that every little preparation that you do eventually ends up being you know, your corpus of health knowledge, but then, you know, you also, I guess, I'm sure in your spare time as well, you do a lot of extracurricular researches into medical interpreting, don't you? I mean, it's not just about I find myself, I might start researching for a particular assignment, and then I might have lost myself for an hour or two going, oh, is that what that is? You know, and I might be watching a YouTube video on a bypass for 2 hours, you know?
So like you say, there's many ways to kind of really discover that avenue of, you know, researching for an assignment. I mean, for me to also have the pleasure of being able to teach again at RMIT, having graduated from RMIT, but to teach at RMIT is also another way for me to kind of really keep up that reading, because I need to be aware of a lot more. I have a son who frequents the Royal Children's Hospital for some medical conditions. So I find myself as well, you know, I don't need to just know the English. I am also researching his conditions in Arabic as well. You know, it might be a rare condition, but I'm also reading up and trying to keep up with a lot of things. And all this information is kind of stored in this bank that you can always go back and, oh, I've done so many mental health settings that, you know what, you know, talking about depression is not a thing. It becomes an easy process to recall the terms, the appropriate terms, to be able to express better yourself, whether in English or Arabic, for me, in these situations. While some might find it nervous because I've not done this before and it's new for me to kind of be, you know, expressing feelings and emotions. So that's also another, maybe leading us into, you know, Beyond Blue, organizations like Black Dog. You know, I go back to Embrace, which is a multicultural mental health resource as well online. Yeah, you can really get quite a lot from having that register, having that bank and wealth of language and words that you could use, that you could recall and call upon when you are in these situations.
Just to give a little bit of a summary of these resources that practitioners can access to help prepare them, we said Better Health Channel. That's a Victorian channel, Victorian website, isn't it? So that could be Victoria specific. Health Translations Victoria, Cancer Council, Health Direct. I find quite useful too. Also for mental health, we said Beyond Blue and Black Dog, you said, and Origin. Origin Youth as well, I find quite useful.
Yes, and Embrace Mental Health.
Embrace Mental Health, that's another one, very good.
Yeah.
Now, of course, as you know, when we're doing our preparation, we do our preparation in English, and we also do preparation in our LOT as well. In your case, it's Arabic, in my case, in Turkish. And we have to do research on parallel texts as well. I mean, where do you go overseas to do your research? What kind of websites do you look at in regards to your preparation in your specific language?
Yeah, I like a website called TIB-Time, T-E-B Time, T-I-M-E.com. It actually has a lot of medical information. It has all sort of the human body, the different systems. It has illustrations and diagrams. It takes you diseases by organ to diseases by letter, by name. It's very detailed. And I find myself, you know, if you're not sure about your biology, you know, download a biology book from year 9, 10, and 11 from your back home country, because I know, I mean, I studied in Damascus, and, you know, a great resource. Education is all in Arabic, and there's a lot of work that's been kind of put behind the scene in these resources. So why not get your hands on a year 9, 10 book and have a look at the different titles of organs and body systems and things like that. all in the way that if you don't know, then you have the knowledge. Then you don't have an excuse to make a mistake, or to mislead, or to confuse even, not nor your patients.
Indeed. I also find it quite useful when I'm doing some parallel text research. The kind of websites I always find I'm ending up in is usually government websites, like it could be the health department of that particular country. Again, very similar to Australia, hospitals have really good information in regards to diseases and treatments. And I also find that you got to kind of keep things, websites that are more formal. So like I said, it could be government, it could be formal institution.
Education.
Just got to try to stay away from blogs and more personal kind of websites, I think.
Yes, don't use Facebook for information about a procedure, because that's not a trusted resource. I recommend always sort of, government, educational sort of institutions that you can somewhat, it's backed by science, it's backed by research, it's backed by a government that's trying to educate its people. Always, if you're unsure, things like Medicare, there's lots of, it is a government body, there's lots of information in your own language. So don't be afraid to go and look up, what bulk billing might be.
That's right. Because, a lot of people are doing healthcare blogs these days and writing about their own personal experiences. I think we just need to make sure, as interpreters, as informative as they might be for people who are in similar situations, as interpreters, I think we need to go to resources that are scientifically backed and vetted,
100%.
like
100%.
government and institution websites.
100%. And trust whatever the Royal Children's website has, that it's 100% true, and that the doctor you are seeing that day is not going to be too far away from what's written on the website. So again, just backing up that idea that, everything that is a recognized institution or a government department, that we trust that the information there is absolutely backed by science and by people who are experts.
Dina, what do you do for ongoing preparation? Is there anything in particular that you do? Any PDs that you've done, recommended?
I love PDs. PDs are great because someone else has gone and done the research and kindly given us the highlight of all that, and then given us some resources to also rely on or to reference, which is great. I attend PDs, whether they paid or free. I see what also is available, and I make budget for that, because I think also if you're not gonna keep up your own research, you also want to see what else has been out there and done. There might be a speech pathology that I'm never going to be in touch with a speech pathologist, but who says that my next phone call or phone interpreting job is not going to be about speech pathology? I might need to know. So I think educating yourself and seeking knowledge is not just limited by the job that you're going to do. It's an ongoing thing. We have to evolve as interpreters, and really not just think my Arabic is enough, my English is enough. No, it is not. It never is, because who would have thought that with coronavirus that we would need to find the word for social distancing? Like,
that's right.
But that only came in 2020. Before that, it did not exist. So we can't be in the dark about that part as well.
Indeed. I think the most dangerous thing an interpreter can do is think they have reached perfection and they don't need to do any more.
That's right. We need to, and also, not be scared of sharing or reaching out to a mentor, to a senior colleague or a senior practitioner, or even to seek, on a forum, to seek an answer on a forum or something like that. I'm also a believer of having a network of people that you can rely on, you can reach to if you want more and you don't know where to go, then, be part of a network, find yourself that network, whether not just practitioners in another language, but also in my own language. It's very important and it's very healthy.
I mean, you're very right. It can be a very lonely profession being an interpreter. And I think it's very important that we do find a network and we are always in connection with them and sharing our experiences and knowledge.
Absolutely. I say to my students, if I could, that I'm in touch with my professors, that, with my Arabic teacher from 10 years ago. And whenever I'm stuck for a word, even if it's after the event, I'm reaching out and I'm saying, I need your guidance. How would you say that? I met some colleagues on a conference last year, and I made some connections, and then they're also great resources. I met you last year as well, and you being a great resource. So it's not about a working opportunity. It's not about that person is going to return $1 for me, but, sharing that knowledge and increasing your wealth of knowledge is way greater than that monetary value, I think.
Dina, thank you so much. It's been a delight talking to you, and I am sure it's been very informative for our practitioners out there. And I hope to speak to you again soon.
Me too. Thank you so much for the opportunity. I appreciate your time.
Thank you, Dina. Be well and stay safe. See you later.
You too. Bye.
Bye.
All Graduates Conversations Podcast.